What about if you're in a big crowd, like in a sanctuary, a ball game, church service, or something like that? You know, people's in there coughing and sneezing and things like that. Um, Hand sanitizer.
That's exactly right. And that's why you see throughout all these places all this hand sanitizer. And so I carry it with me. I see it all over the place. We disperse it everywhere we can because the CDC, the Centers for Disease Control, they say it's just as effective using hand hygiene with alcohol foam or alcohol gel based content
Hmm.
as it is with the hand washing. The difference is if your hands are soiled, then you need to use soap and water. And
That's
soap
amazing.
and water is really good. You know, my mom only had a seventh grade education, but she was one of the smartest women I ever knew. And so whenever she would do anything, it was wash your hands. Anybody'd go in her kitchen, have you washed your hands before you start preparing food? And it's just simple, the basics. You don't have to have 5 PhDs. You don't even have to go to school all your life. It's just common sense things. Hey, let's wash our hands. And I know you hear that, but if you go to places like some of your local places that has bathrooms and stuff, and you go in those bathrooms and you watch people, they do not wash their hands like they should because they think it doesn't affect me. But you know, just like this influenza, you think I am healthy, I am not going to get infected. But this influenza that they're seeing at this time of year, it's hitting your working class people.
Hmm.
It's hitting people that are your middle aged, your younger kids. It's not necessarily hitting the older people because they think that somewhere in their past, the older people may have an immunity to this. That does not mean, though, that older people does not need the flu vaccine because the rationale is if you have comorbidity factors, things that make you higher risk, then certainly you need this. But even if you're not at risk, if you're working and you need a paycheck, then it's a good idea to be prevented against the flu because what happens, you may have the best intent in the world, but you cannot work whenever you've got the flu.
Mm.
You cannot do a good job. You cannot be at all your very best.
What about, touching on the T zone? That's your nose, your mouth, and your eyes, and things like this,
Hmm.
keeping your hands away from these areas. What about nasal saline? Using that as a tool to clear out your sinuses and things like that.
We do see it recommended, and what I would advise somebody to do is to talk with their local doctor or local health care giver and see what they recommend. We never ever go above what physicians recommend for their patients
Hmm.
because the physicians know their patients best, but certainly we can tell you the best way to prevention.
All that is so great. You got all these different types of disease and cold and sickness. You got bronchitis, you got pneumonia, you got lung infections, just different things that can be avoided by simply washing your hands and keeping your body in check.
And that's exactly right. Because what happens is when you don't wash your hands, that breaks that chain. That allows you to become infected. And you know the thing about hand hygiene, you don't have to wash them in really hot water. You don't even have to use an antimicrobial soap. You can just use a simple soap and water because it's a mechanical action itself. And if you don't care, take my microphone and let me demonstrate the
Okay.
proper way on hand hygiene
All right.
because you see this so often. What you do is you turn on your faucet and you wet both your hands. And then you get your soap. So many times I have seen people get their soap with one hand and wet their hand. But what you're really doing, especially in the wintertime,
Right.
when your hands are dry, you've got that you've got that skin, then you've got a chemical, then you've got water. Now,
Mm.
Jonathan, you try washing your hair with just putting the shampoo in first. It does not work as well.
Mm-mm.
Wet both your hands, then put your soap in, then wash your hands 15 to 20 seconds, then rinse your hands, then take something and dry your hands, a paper towel, and then take a dry paper towel and turn your faucet off. Because what happens is people will dry their hands and they'll reach over and turn the faucet off, and then they've reinfected their hands again.